Dr. Barnarotti, who's a neurosurgeon, will be joining us along with this gentleman. He is Dr. Cabezi. He is the director of the Pain Medicine Division at the Allegheny Health Network. You know, a lot of the negative news that's out there concerning opiates, well, that's one thing, but they still have a purpose in medicine, right, Doc?
Absolutely, they do. We use opioids when they're appropriate for long-term care and obviously for short-term care, acute pain.
One of the things that people have been talking quite a bit about is legalizing marijuana for pain purposes. Your thoughts?
Well, I think that some of the evidence is lacking in regards to long-term effects of medical marijuana. We do know that it does have effects on young developing brains in children, but we're anxious to give it a try at the Allegheny Health Network. We think that there is promise there.
When you think of opiates and how far we have come with them, but still we're dealing with this issue, how do you think we really manage it and find that balance to where we can use them in a surgical setting or in post-operative care, but more importantly also try to protect the innocent people that end up becoming addicted to these medicines and then obviously are dealing with a serious issue?
I think what we need to do is look at what we're prescribing post-operatively. We shouldn't be prescribing any more than perhaps a week or 10 days worth of medication until the patient can get back to the surgeon and have a reevaluation at that time, as opposed to giving them a month's worth of medication that they may not need. It sits in the medicine cabinet. One of the children or a guest can have access to it, and we need to at least look at what we're prescribing when the patient leaves the hospital.
Please don't miss this very informative program tonight, Pain Medicine, the topic of conversation. Dr. Gerald Pfeiffer, your host, the Allegheny Health Network program, Medical Frontiers, on News Radio 1020 KDK. Good evening.